I just wanted to say welcome, everybody. We have a lot of information to cover tonight, and I'm so glad that you've joined us. My name is Sarah Maslin-Fothery, and I'm the Director of Parent Relations at Dickinson. It's wonderful to see so many junior and senior families who are logging on right now, and I just want to say how much we appreciate you making this presentation a priority. Also, thank you to many of you who submitted your questions for our panelists in advance of this session. We know that these past 8 months have been challenging and have affected your families in many unique ways, and we appreciate how much you care about Dickinson and your students' experience during this time. All of the questions and submissions of feedback that we received from parents and students and other members of our community have been reviewed by our college's senior staff and are all being given great consideration. And through their remarks this evening, our panelists will cover much of the questions that we received, but if there's something that we do not cover, please submit those through the Q&A feature of the webinar, and we'll address those as we're able. If we cannot get to it this evening, we will follow up with you afterwards. And you're also welcome to continue to submit questions to ask@dickinson.edu, and we'll follow up with you after the presentation as well. Lastly, I just wanted to mention that this session is being recorded and will be available to you after our time together concludes. So after sharing all of those logistics, I just wanted to again welcome you and say how thrilled I am to have the opportunity to introduce to you Dr. Margie Ensign, Dickinson's 29th College President this evening. Margie's steadfast and confident leadership during these difficult times has been very inspiring. With the support of many campus partners, her deliberate and thoughtful decision-making has allowed us to remain not only stable, but strong and positioned well to support your students in any environment. I'm pleased to turn the session over to her for further introductions of the college's staff members who've joined us here tonight and to share her own remarks. So thank you, President Ensign.
Thank you so much, Sarah, for your remarks. And good evening, everyone, or good afternoon, or good morning, depending on what time zone you're in. Thank you so much for being with us. And as Sarah said, thank you for remaining Dickinson strong during these most challenging moments. Before we begin tonight, and we do have many questions, actually about 6 pages of questions that you've submitted, and each of my senior staff have categorize them. So we'll go through those as quickly as we can, but let me introduce my wonderful senior staff to you. On the screen, you'll see Neil Weissman, Provost and Dean of the college. Neil, say something so they can see you.
Sure, no, hello, I'm waving.
George Stroud, Vice President for Student Life, Dean of Students.
Good evening, everyone.
Bronte Burley-Jones, Vice President for Finance and Administration.
Hello, everyone.
Don Dominici, Executive Director of Dickinson's Wellness Center.
Good evening.
Angie Harris, Associate VP of Student Life, is off screen and will be answering questions, helping us answer questions. Will come on, will be video enabled, as they all will, if there's a question for one of them. So off screen is, in addition to Angie, Kathy Davenport, Vice President for Enrollment Management, Dean of Admissions, Karen Ferniak, my Chief of Staff, Kendall Isaac, our General Counsel, and Connie McNamara, Vice President for Marketing and Communications. So I've grouped my questions into several, and I'll tell you what they are, and I'll go through those and then turn it over to our Vice President for Student Life. So there have been many questions asking what has changed from the fall that allow us to open? Secondly, why this particular decision? Why half at this point? What does our community look like? You all know how important the community is that your students will be in. What does that look like? What are we doing to protect our students there? And finally, I'll make a few comments about athletics. So what has changed since the fall? As you know, in the fall, we were unable to secure rapid and reliable testing. There's at least 2 things, many more actually, that have to be in place to be able to manage and control outbreaks during a pandemic. One is reliable and rapid testing. The second is contact tracing. The third is personal responsibility and following the guidelines. And Vice President Stroud will talk about that. But in the fall, we were not able to get the testing that we felt we needed to be able to control this and create a safe environment for all of our students. The group we had contracted with, as I said in my summer notes to you, changed their turnaround time as demand increased from a few days to a few weeks. which made this really impossible. In addition, the state had not established contact tracing, which is the second critically important piece. So what's changed? Recently, we've been able to contract with the Broad Institute at Harvard, arguably the best in this area, and Don can speak to this also. And while 6% of American colleges and universities will be testing, have been testing once a week, we will be testing twice a week. So we feel that's critically important to ensure safety. Second, on contact tracing, the state has put a program in place, hired over 1,100 contact tracers with one assigned to our area. And Dawn and others have been working with this person. And there's also an app for Pennsylvania that I would ask all of you, if you're here now, or certainly when you come, that you will be required to download COVID Alert PA. So a lot has changed since the fall, but why only half? I was on a call with students today and said, if you've all got all these great things in place, why can't you bring us all? First of all, we have to set aside a certain percentage of our rooms for isolation and quarantining. And when we look at our entire student body, and we'll have many more juniors with us than we normally do. The provost can correct me if I'm wrong, but almost 2/3 of our juniors are abroad during this period. And unfortunately, we can't do that. So our numbers of students is much higher than normal. And when we looked at that, and the rooms we have to put aside for quarantining and isolation, we simply couldn't safely bring back the entire student body. We know that students want to be back overwhelmingly. Vice President Stroud and Angie did a survey, and we know you want to be on campus. And to try to do both things, with health and safety as the priority, we decided to bring half at a time and flip at the midterm. Seniors have said, well, why didn't we get to come in the beginning? We very much want you on campus for your commencement. And that's why we chose actually juniors and seniors for the second part of the semester. The third question surrounded our community. What does our community look like? Well, as we look not just to Carlisle and Cumberland County, but around the country, you're following this as well as much as we are. Unfortunately, positivity rates are going up, and they are for the first time in Carlisle and Cumberland County. However, yesterday, I'm proud to say our Dickinson's Community Action Network launched our masking campaign. As of today, we have passed out 4,000 masks to our community. So when students do return, and for everyone living in Carlisle, any business or restaurant or organization that has taken our pledge to wear masks and practice social distancing now has a poster in their window. So that's a safe place to go, to shop, and to get food. So that's been a very important initiative. Finally, athletics. I know there's many athletes on the call, and the President's Council is the group that will make the decision for the Centennial Conference. We're meeting very regularly. We have another meeting in several weeks before the end of the year where we hope to make some decisions. We're not there yet. As soon as we make that decision, we'll announce it to you. But Vice President Stroud will talk a little bit about practicing. So I thank all of you again for being with us, and I'll go ahead and turn it over to George Stroud next. George.
Well, good evening, everyone. Thank you, Margie. And thank you all for joining us today. I'd like to take a few minutes just to talk about some of the questions that many of you presented to us over the last couple of weeks regarding student life and the student experience here. I would like to begin by addressing housing, because that seems to be the greatest concern, and understandably so. Last week, students should have received information from Residence Life outlining the process for applying for on-campus housing. And so I'd like to just go over a few of the details regarding that particular process. The first really important deadline for each of you to know is that November 29th, which is just 10 days away, is the date that we have asked everyone to submit to us their intention as to do they want to be on campus next year. It is really important that you let us know that, because from a planning perspective, Residence Life needs to have that information so that they can move forward with the process there. Some of you have asked, well, if I submit my intention at that point in time, am I locked into that decision? And the answer is no. If you change your mind later, we definitely understand that. But letting us know that information now at least allows you to be in the pool so that you can have housing for this coming semester. The other issue is that there were a list of exemptions, potential exemptions for people to have housing. And as you know, many of you, that currently we have about 160 students who are on campus, and they are on campus for a number of reasons. Most of those reasons involve either they were international students who could not travel home, or there was some type of access or equity issue that our students were facing, that had we not allowed them to stay on campus this semester, would have severely hampered the students' ability to get their education for this semester. We anticipate that we will continue with those students on campus, and anyone else who has similar concerns or issues, they will also be allowed to stay on campus. There are also, as the letter that you saw, there are a list of, I think, 4 or 5 other potential groupings or areas or issues that may be raised, in which we will consider, if there is space after we house our students, if there's space, we will consider allowing those students to come on campus as well. And so come on campus for the full semester, that is. And so I would ask each and every one of you, if you feel as if you fit into one of those categories, please submit your application and we will review that immediately. Those of you who have asked for the exemption to remain on campus for the entire semester, you will be informed as to whether or not that exemption has been accepted by December 7th. Okay. Now that date is important because the week of December 14th is when we will open up a housing lottery for all of our returning students who are eligible to return in January. So our current our sophomore students and any upper class student who has the exemption will receive information about the housing lottery, which will take place during the week of December 14th. That answers a question, because I've had many questions asking, will we be able to choose who we're going to live with or who we're going to live near? The housing process for the upper class students provides that opportunity. So please take that seriously. Talk to your friends if you want to live with them or near them. And as you go into the lottery process, be very specific about where you want to live. The other issue is we're trying to create pods, which, or we can look at these as family units. And the purpose of the pod is for these groups of students to engage with each other socially, perhaps go to dinner with each other, and to really stay in that particular group for the most part. It doesn't mean that these pods would never interact with other students. However, it's very similar to, I will say, my household, where my family, we may go out and about, but when we come together, we know what the situation is as far as our health and wellness and where we've been within that group. And so it makes it much easier for us to trace our steps within that pod. And so you will then choose within those living groups. The way we will create the pods is it will be likely a house, an apartment, a wing of a floor, or for smaller floors, maybe an entire floor. We'll create those pods. And so it'll be really important for you to really take notice and be mindful as to who you would like to live near, and to be pretty strategic about that process there. The next piece that I'd like to talk about, is there are questions about single rooms or double rooms. We do anticipate that many folks will want single rooms, and that's how we have built this process, that many people have asked for single rooms. But as we talked, and the survey that we sent out a few weeks ago, we also understand that there are a number of students who would really like to have a roommate. And so we've built a process that will accommodate a few roommates as well. And so if you would like to have a roommate, please make sure that you indicate that as you go through the housing process, so that those slots are available for you there. As far as move-in is concerned, for those students who are eligible to move in January, So those would be our first year and sophomore students and any upper class student who has received the exemption. For those upper class students, your move-in date will be January 22nd through and 23rd. And that is a Friday and a Saturday, January 22nd and 23rd. At a later date, those of you who are eligible to move in at that point, you'll receive information for a sign-up day and time. We will ask that you make sure that you stick to those times, because what will happen, and Don Dominici will be talking in a little bit later about our testing protocols, is that when students arrive on campus, they will be tested. And so it will be really important for folks to adhere to the time slot that they have signed up for, so that we don't have long lines waiting for testing, as well as we also do not want a large group of people congregating on the campus in mass, which then would create some safety concerns for us, because we would not be able to maintain social distancing. It is also important to know that Sunday arrival is not possible because we do not have access to testing on Sunday. So please be mindful of that. Early arrivals and late arrivals. Many folks have been accustomed to having early and late arrivals. That will be very difficult for us to do this year as well. So please be mindful of that. For those students who are coming in March, your housing assignments and your lottery process will take place in mid to late January. So more information from Residence Life will be given to you about that process and your move-in dates for those of you who will be arriving in March. So there have also been questions about off-campus housing and can people live off campus? As you know, we have extended our commuter policy to 50 miles or less. So anyone whose permanent residence is 50 miles or less will be permitted to commute to campus and will have access to all of our facilities, and they will have to go through our testing and tracing protocols as well. However, we understand that some people may be considering renting properties off campus, and we are discouraging you from doing that for a number of reasons. One, you would not be a part of the testing and tracing protocol, so therefore there would be health risks, potential health risks to the community. Two, you would not have access to any campus facilities if you were renting off campus. And so we really ask you to refrain from that. And we're really concerned about that issue, because we have a responsibility not only for the campus, but for the Carlisle community. We do not want large gatherings happening in our community. And so we would ask for that not to occur. If that does occur and we find out that there are behaviors that are happening in the community, large gatherings that may present a safety concern, then the consequence for that may result in a separation from the college. So, we really ask folks to refrain from taking that measure there. The next issue is life on campus. What would life on campus look like? What are our responsibilities? What are the expectations of us? We have sent to you and given everyone access to what we're calling a campus compact. And the campus compact is a one-page document that really highlights what our expectations are as far as keeping the community safe. And what are your responsibilities? What are our responsibilities? And what are the consequences for falling short? This is not rocket science at all. These are measures that are in place that we've all heard over the last 8 months: wearing a mask, practicing social distancing, submitting to testing and tracing, letting someone know if you feel as if you've been in contact with someone that may have been infected. And so we would ask that each of you please read the campus compact, as well as the addendum to the community standards, which is a 7-page document that actually goes into more detail about the information that's within the compact. Please read that, take it seriously, and then for those of you who decide that you want to come to campus this spring, please sign that so that we have it on hand. We will also have another copy for you when you arrive on campus, because we understand that signing a document, a month, 2 months ahead of time, you may have forgotten it. So when folks arrive on campus, we will have another copy for individuals who are here. The question is, well, how will this be enforced? What happens if someone runs afoul of the campus compact? And what we were saying is, one, based on the information that we have of the 160 students who are currently on campus, we know that our students are taking this seriously and really want this to work. However, if there are students who show us that they will not abide by these particular protocols, and we cannot get folks to change their behavior, the result will be you will be asked to leave campus and be sent home immediately. And so that will be the consequence for people who decide that they're not going to follow through with those expectations that we have set forth. Guests, will we be allowed to have guests on campus? The answer to that question is guests will be allowed, meaning that students who are approved to be on campus and who are within our testing protocols will be allowed to visit each other in their rooms and engage with each other in small groups. Guests from outside of the campus will not be approved. Again, we are creating a bubble, so to speak, by testing everyone, and we want to maintain that. And if we have guests who are coming to the campus and they're not tested, then that increases the likelihood that an infection may come to the campus, and we want to minimize that as much as possible. The last piece that, or the last two things that I want to talk about quickly are athletes. Margie talked about that a little bit. We understand that there are groups of athletes who would like to come to campus. And as you would have seen in the document that we sent you about a week or so ago, athletics is one of the reasons that we will consider, one of the groups that we will consider for an exemption. If you are permitted to come to campus for the entire year as an athlete, coaches have the permission from the NCAA, whether or not there is competition. They do have permission from the NCAA to hold practices. And so the coaches are looking into that, and they will hold practices with whomever it is that come, either practices or workouts with their teams. And so that will be permitted. Again, we do not know how many athletes we will be able to accommodate, especially for the exemption to be here for the entire semester, but we are going to do our best to accommodate as many students as we can to make sure that everyone is taken care of. The last thing that I have is that there are plenty of questions about a leave of absence. Many students are uncertain as to whether or not they want to come back to campus this semester. And if that's the case and you decide to take a leave of absence, we will understand. There's a leave of absence process that we would ask you to follow. And if you have any questions about that process, please contact Angie Harris, who's the Associate Vice President for Student Life. And Angie Harris can be reached at harrisa@dickinson.edu. Thank you.
Thanks so much, George, for all of that good information. And thanks to you and Angie and everybody on your staff for all your hard work. So many questions are coming in about the testing piece. And I'm going to ask Don Dominici now to cover that area and health and wellness. Don, thank you.
Thank you, President Ensign. So we are getting a lot of questions about testing, and a number of people submitted testing questions early, along with other questions about what will be required next semester, what other safety measures will be taken, how do we handle situations when a student gets sick, and what about their close contacts? How do we handle those things? So I will cover as many of those questions as I can, and any I don't get to, we will certainly respond to in writing as well. I'll start with the testing piece. So as President Ensign has already shared, we have a contract with the Broad Institute, working with a number of colleges, and we are prepared to have them complete bi-weekly testing for all of our students who are on campus, and regular testing for staff and faculty who are on campus and have interaction with other students in the campus community. Some of the questions we received were about, well, what type of tests will they be administering? The type of test we'll be using is a molecular test, a PCR test that involves a nasal swab. A lot of people get a little antsy when they hear nasal swab and they think of the very invasive type of nasal swab that a number of us may have received. That's not the type we'll be using for our regular testing program on campus. If anyone has seen the news story, the video on Cornell University, who has been partnering with the Broad as well, there is an example of the type of test that we'll be using. And it is an anterior nares nasal swab test. So it doesn't go as far up as the full nasal swab. It's going to be self-administered and overseen by a clinician in case a student needs or staff member or faculty needs assistance with the collecting the sample. What we'll do then is we will have it overnighted to the Broad Institute, and they will get us test results typically in 24 hours or 24 to 48 hours at the most. And that will allow us with the bi-weekly, twice a week testing, that will allow us to stay in front of the virus and have information about all of our community who's on campus. In addition to that, we will still be testing symptomatic students at the Wellness Center. We've been doing that for the students who are on campus this semester. If anyone is symptomatic or who has a close contact with somebody who's been diagnosed with COVID, we can still set up appointments at the Wellness Center to have you come in to do additional testing as needed. But the twice a week testing will be our routine testing program, our asymptomatic testing program, that everyone will need to complete. A couple of questions were asked about, well, what happens, what's the process, how do you sign up? There will be an app that the company we're working with utilizes to sign up. You'll have a regular time that you come in each week, and we want to make it as streamlined and as user-friendly as possible. So more information will be out about that as we have the details, as we have it described in more detail. But hopefully that gives everybody a little overview of what it might be like. And again, check out the video in Cornell, because that's the idea. It's the type of test we'll be using. And we're hoping that even if it's a little difficult at first, to kind of get used to it, that after a couple times, people will get used to doing the self-collected test, and we'll be able to be in and out as we go forward. We've been asked several times about wastewater testing. I know there are some colleges that are testing their wastewater to try to get a sense if there are particular dorms that have a positive case, and then they could test everybody in the dorm. We looked into this option, but the logistical layout of our sewage structure on campus does not allow for that. It wouldn't give us useful information. We can't isolate it to a particular dorm or even a particular area of campus very well. In addition, we'll be testing everybody so regularly that we will be getting data on everyone. We'll have hopefully have a good sense early on when people are positive, and we'll be able to respond. So what does the response look like? If we have somebody that tests positive for COVID, we have a team that will follow up with that particular student. We will have them come in, or we'll have them discuss isolation processes with them. We will get information about their close contacts here on campus and reach out to those students or faculty or staff who might be at risk as well. The Wellness Center will work with our Residence Life team and with human resources for staff and faculty to follow up quickly with anybody who might be affected. A person who tests positive will be moved into an isolation housing where they will have their own room and their own restroom. They won't be sharing any space with anyone else. We will have regular follow-up with that person via daily screening tools that we will want to have people complete, and regular phone calls from the wellness center. Our residence life staff will coordinate with dining services to have food delivered, and to make sure that students are able to bring any essential belongings to the isolation housing before they are moved. We envision this as being a quick process, and we've had a chance to implement it on campus this semester. So we want to get in front of people quickly. And again, those close contacts, we're going to call them in. We're going to test them as well, and they will be instructed to quarantine. Depending on the situation, if somebody has had close contact, and in most cases they would with everybody in their pod, we will have those students quarantined together. If it's an individual case of somebody that I had close contact with outside of my residence, we will quarantine that person individually. And again, we would test them as well. Just like with somebody who's sick, we would follow up with those students in more than one way. We would be sending them messages. We would be calling them. They would know where to who to contact if they need anything. We want to make sure that if somebody has worsening symptoms, they know immediately who to talk to, and that we would be checking in and being able to respond if we need to do something different with them. In addition to following up with people who are in isolation or quarantine, we will continue to use our daily symptoms tracker that we expect anyone who's on campus, employees or students, to use on a daily basis to indicate whether they're symptomatic, they're having symptoms, or if they've had a recent exposure. And that's another way that we can get in front of people quickly. If somebody indicates, I woke up, I'm having some symptoms, we can have our medical staff evaluate that person, and then if appropriate, test them and move them to isolation. In addition, a couple of other things that we had some questions about in terms of requirements for next semester. The restricted movement period for the first 2 weeks of campus, in addition to having a requiring pre-return COVID testing and the twice weekly testing when you get here, including at move-in. We will implement some restrictions on movement in the first 2 weeks. It's essentially a stay at home unless it's for essentials. If you need to go pick up food, if you need to go to class, if you need to, if you have in-person classes, if there are medical appointments you need to go to, we just want to have a little bit of a limitation on movement for those first 2 weeks as we get the initial test results in, and ensure that no one has tested positive over that period of time. Vice President Stroud mentioned our requirements around social distancing and face coverings, which those have not changed. There's information on our FAQ page about the types of face coverings that are required and in what situations. This is a very timely meeting tonight. 2 days ago, the Department of Health and the state of Pennsylvania implemented some new guidance and new regulations around masking, and new guidance for colleges and universities in Pennsylvania. I was very pleased to see in looking through those recommendations that we were doing most, if not all, of the things on there, and didn't really need to tweak our plan very much. Most of the stuff, the major categories, we have it covered, and we're just sort of working out the details. Flu vaccine, got a couple questions about that. And they are required. We were asked if it was required even for juniors and seniors coming back during the second half. Yes, we're still, at the tail end of flu season there. We want to make sure that we are limiting the amount of people in our community who are experiencing symptoms that might mirror COVID symptoms. So we have fewer people who we are needing to isolate or quarantine, and who need to seek medical assistance. There's information on the FAQs about flu vaccines as well. A couple of people have asked about exemptions for medical reasons or religious reasons. That information is on our FAQs, and if you fall in that category, you can contact the Wellness Center and then let us know. In addition, there's information on the FAQs about how to submit documentation that you received your flu vaccine. So take a look at that, and you'll have to have that sent before you come in. One more thing I will address. There was some question about what about students going home this semester? I know this doesn't affect many students right now, but we did get a question about how are we taking safety precautions and sending students home. We are offering testing for any student who's on campus right now, even if you have no risk factors and you want to get testing before you go home. The Wellness Center is doing that. We've had people coming in all week. We've been had regular appointments throughout the past few days, all day long, where students who want to get that test before they are going home for the winter break. Next semester, we won't need to do that because we'll be testing regularly anyway. We will have it covered. But this semester, we are offering that to help with health and safety upon going home. I will stop there, and we'll try to address some other questions in writing if they come up.
Thanks so much, Don, for your
you.
thorough answers. Two things came up I just want to say before I pass it over to the provost. Many of the protocols that Don mentioned we have in place because, as you know from my last email, we have 3 positive student cases on campus and we're dealing with those. Going forward, we will have a dashboard on the front page of our website, so you'll be able to see where we are with the statuses. And Don also mentioned very rapid change in state regulations. One of you have said, could any of the comments we're making tonight change? Yes, absolutely. We live in the state of Pennsylvania. We follow all of those regulations. There's always a possibility there'll be additional ones, as well as federal regulations, which of course we will follow. So thanks, Dawn. And I'm going to turn it over to our provost, Neil Weissman, for some comments on the academic side.
Okay, I'm going to make relatively brief comments. I know there are lots of questions, and I encourage you, particularly the students, to be in touch with your academic advisors and or directly with me if you have issues that we don't cover. Essentially, there'll be 2 kinds of classes going on in the spring. One of them will be classes that are entirely remote. We are not requiring faculty to come to campus. A good number of them will have health issues. A lot of them have concerns about elder care and also child care. And so those faculty will be doing most of their coursework remotely. There are also some faculty, by the way, who believe that operating remotely may be actually better than having classes that are in person under pandemic conditions. In-person teaching will take place in classrooms where everyone is distanced by at least 6 feet. There'll be masks, or in some classes, probably clear face shields so people can be seen. And that places some significant limitations on what can be done too. So there will be a significant remote component. There also will be hybrid classes. Hybrid classes obviously are those that have a remote dimension and an in-person dimension. So almost all will either be remote or hybrid in the first part of the semester. And since we have classes all the time in which there are representatives from first years, sophomores, juniors, and seniors, there's a mix. We can't separate them out and don't intend to. So in the first half of the semester, there'll be a lot of first year and sophomore kind of dominated courses, but we'll have juniors and seniors in them. And those juniors and seniors will be coming from a distance. And then in the second half, it'll be the other way around. And we do want to guarantee all students, including those who choose to stay remote for the entire semester, that you will have access to all classes. We're particularly focused on the seniors in that regard. We want to be absolutely sure that all of you can get access to the courses that you need in order to be able to graduate on time with what we hope will be an exciting in-person commencement ceremony. If you have difficulties, if there's any problems in terms of completing your program this semester, you need to be in touch again with your advisors about it, and we'll work out options, ideally to make that possible for everyone. In terms of, I should say briefly that this last fall, all of the reports that we're getting are pretty positive about how things went. in terms of remote instruction. And we'll know more because, as students know, we are doing student evaluations this fall, and that'll be illustrative. The one complaint that seems to have emerged the most, and that's felt on all sides by students and faculty, has to do with workload. I've had several students, and frankly more parents, say, our students are pretty taxed with the amount of work that's being assigned. And is it the case that faculty are imagining that students are stuck at home and so have nothing to do, and therefore they're kind of upping the workload? And I can assure everyone that is absolutely not true. No faculty are thinking that way. But judging what is the right amount of work and how much, how many assignments can be done effectively in a remote context remains relatively new to faculty, and sorting that out is a challenge. If you're having difficulty with it, by the way, as a student, you want to, again, be in touch with your faculty member, or if not, email me directly. We think that this will certainly be the case, that it's going to be a challenge in the spring. And so we're focusing on that during the break between fall and spring with faculty to really work with them to make sure that that's manageable, especially in hybrid courses, which are going to be new to them. There will be some exceptions in terms of students being able to petition to be here the full semester, some on the academic side as well as on student life side. So for example, we have a petition from our senior studio art majors to allow them to be here because they need access to studios. And there'll be other students with special projects who fall into that category, and you should let us know if that's the case. You will need support from a faculty member in order to make a successful petition. And our intent is to kind of fill up to the capacity that we think will be safe. And once we know how many students, first year, sophomore in the first half, junior, senior in the second half, are coming back, then we'll know what kind of capacity we have to accept petitions of all sorts. All of the campus facilities that support the academic program have been available online in the fall, and they will be available online in the spring as well. And we hope to have as much in-person activity around that in the spring as is safe and possible. So for example, one question that's come up is, will the library be open? And the answer is yes, it will be open. There'll be reduced capacity. They've been taking out every other chair, for example, in some of the rooms. We're not going to nail what's left to the floor because we trust students to use good judgment about that. But the capacity will be reduced. Nonetheless, it will be open. And so, as a general rule, the primary concern is safety. And after that, we want to provide as much in-person interaction on the academic student life side too, as we reasonably can. So for example, it may be the case that even faculty who are teaching remotely may be willing to do one-on-one office hours and advising in person in the beginning of the semester in a place that allows proper social distancing, which most of their offices won't. But later in the semester, when juniors and seniors are back, there's always out of doors. So again, our intent is to keep you safe, but to provide as much of an in-person interaction as is possible. One particular question that's come up, and I'll end with this one, though there are of course many more, is about study abroad. We're not doing study abroad in the spring, again, primarily for safety reasons. That's the overarching concern. But we really do want to guarantee that people will be able to have an abroad experience. So if you go to the website for the Center for Global Study and Engagement, and I think there's also a link in FAQs, we're setting up a series of what's called globally integrated courses, in which the bulk of the coursework will be done in spring remotely or on campus. But at the end, there'll be a 3-week session abroad in one of our centers, typically. And those courses will carry regular credit for the on-campus component and a half credit for the session that would be abroad. And financial aid, by the way, will be available for those courses. So you ought to take a look at those. Additionally, our plan, our strong intent is to run our abroad programs in the fall. So they'll be back online and back in business. And we understand that there will be a good number of students, juniors who will be by then rising seniors, who are going to look to an abroad experience in the fall, or in some cases, it may work better in the spring. So we're going to be planning at our sites abroad for not only the usual kind of junior enrollment, but also a good number of seniors who haven't had the opportunity during the year. And for one specific, I got a question about this. If you've been approved for study abroad in the spring, you don't have to reapply. All you have to do is email Global Ed in order to let them know that it's your intent to do that again in the fall or spring of your senior year. So they'll have that on record. And with that, I'll stop.
Whoops, sorry. Thanks so much, Neil, for all of your great work and your all of your staff. Last and certainly not least, I'm going to turn it over to Bronte Burley-Jones. She's going to cover everything from lots of questions coming in: dining, meal plan, facilities, including cleaning, and tuition, room and board. So Bronte, over to you. Thanks so much.
Okay, Margie, here we go. The first topic is student billing. There have been lots of questions about room and board. Will it be prorated? Room and board will indeed be prorated. Bills will go out in early January. You can actually log into Dickinson Gateway to assess your bill through e-billing channel. The due date for the invoice is January 22nd. Lots of questions coming in this evening about the refund policy. So our refund policy remains as it has been for prior years. The difference will be relative to room and board. The start and end date for your 7-week period is what we will calculate your room and board refund based on. So if you come and decide that you don't want to stay, we'll calculate your refund based on the start and end date for that 7-week session. Lots of questions about our cleaning protocols. So you should know that all of our housekeepers have been through training, so that we'll be using all of the proper cleaning supplies that are CDC COVID recommendations. We've actually also secured the appropriate PPE and additional equipment to make sure that we keep the campus safe. So all of the larger residence halls will be cleaned Monday through Friday, 7 to 4. Restrooms will be cleaned twice a day. And that's going to include the sinks, the handles, the drains, the countertops, the floors. Trash will be removed and toilet paper and soap updated and refreshed during those 2 cycles. Showers will be cleaned twice a week. And so we'll be spraying down the partition walls and the floors, and we'll be cleaning the drains and the vents. Paper towels and soap dispensers have been installed in all of the restrooms. All of the electronic hand dryers have been disconnected, and disinfecting wipes have been provided in all of our restrooms. Important to know that all of our building entryways now have sanitizing stations, so that as you enter and exit the building, they are at our primary entrances. Our housekeepers are actually on staff in place now doing extensive cleaning, and prior to your arrival, they'll be cleaning all of the high traffic areas to include hallways, lounges, and bathrooms. We've secured new machines, the Clorox 360 machines. They allow us to disinfect areas 99.9% of bacteria within 5 seconds. We have several of those machines in place, and we'll be deploying them across the campus. The other thing I want to point out is that we will have disinfecting wipes in classrooms, bathrooms, and common spaces. So we will be asking members of the community to wipe down tables, chairs, computers after usage, because we're all going to have to be in this together. So those will be plentiful across the campus. So now let me slide into dining. Questions about whether there will be refrigerator and microwaves available. We're setting aside 50 of those for our isolation and quarantine rooms for obvious reasons. But there will be another 95 available for students to rent. And you can do that through the bookstore portal. Dining in general. So the meal plan is required for all of our residential students, as has always been the case. We do have a new COVID meal plan in place that's being offered. It's a 20 meal per week plan that allows you 1 entry per meal. So there were questions about why 20 versus 21 meals. I think most of our upperclassmen understand this. Saturday through Friday, we've got 3 meals a day, and on Sunday, we've got lunch and dinner. We are not offering the apartment flex plan this semester because we want to limit the off-campus foot traffic, both to protect our students and also members of the community. That said, I want to point out that the meal plan charge for the spring semester is well below what we would charge for any of our meal plan options. So we recognize that you will have fewer retail location options, and service hours will be slightly adjusted. So we are accommodating, we're correcting for that in the charge for the semester. Relative to food safety, social distancing will be practiced in the dining hall, in Union Station, at all of our grab and go locations. Our staff will be using face coverings. There will be no self-serve food during the spring semester. Staff will be doing all of the serving. Again, that's to protect you. In between all meals, we will be using our Clorox 360 machines to totally disinfect each of the eating venues. Want to point out that our dining locations are going to be restricted only to meal plan holders. So faculty, staff, and commuting students will not be allowed access into the dining hall or into Union Station. That's going to be reserved for students on the meal plan. Questions have been asked about, are you going to be assigned specific meal times? The answer is no. We want you to be able to eat with your friends. That said, we will be capping meal times at 30 minutes so that we can ensure that we can have traffic in and out of the areas. We will have grab and go during the first 2 weeks of classes while we're having limited movement around campus. But immediately following that two-week period, the dining hall and Union Station will open for all 3 meals. Union Station will offer its regular suite of offerings. And the dining hall will have everything that you're used to seeing there. The Cove, the grill, the deli, hot entrees, and the like. We will have grab and go locations in 3 spots on campus. So the Hub Underground, the Klein Annex, and Rector Science Complex. Those will be open in between meals so that you can actually grab meals to go. Questions about the hours for Union Station. Want to say that Union Station will be open until 10 p.m. And so you'll be able to get those late night snacks. I saw a question come in about accommodations. Meal plan accommodations and exceptions will still be coordinated through Marnie Jones and the Office of Access and Disability Services. So I think I've covered some of the primary questions. There were questions, Margie, about student employment. We've actually done a pretty extensive list of questions. There will be a wide range of employment opportunities on campus, both work study and non-work study. So please take a look at the FAQs because we've tried to cover all the questions that we've received to date. Margie, I'll turn it back to you.
Okay, thanks so much, Bronte, for your comments and your great work. Students and parents, I hope you're picking up with these presentations, the enormous amount of effort that's gone in here to get the testing right, to make sure the facilities will be ready for you and clean. So it's an enormous amount of work, and I thank everybody on this call. George, we've got a few minutes left, and not surprisingly, many of the questions are in the area of student life. I've tried to categorize them. It seems to me that 2 of the most commonly asked are about disability and the lottery, disability accommodations and the lotteries. So a number of questions about the lotteries from the last time compared to right now. So if you could take those 2, and I do want to remind everyone, we're taking all of your questions while many are being answered while you're on it. We'll roll these into our FAQs that'll be on the webpage. But George, you go ahead.
So as far as the lottery is concerned, as I'm reading through those, I know Angie is in the background. She's answering a lot of those questions that are coming because some of them are pretty specific as to what's happening. So Residence Life is running that particular lottery. But what you need to know, because I saw some questions asking, well, why can't folks just stay in the room that they had already been assigned to, and so on and so forth. One of the concerns is that we had to take, we took about 10% of our beds offline for this coming semester to account for quarantine and isolation. Those are beds that were already assigned to folks for this year before we did that. So when you account for those beds coming out, that means that those individuals who would have been assigned to those rooms would need to be moved elsewhere, which then moves everything around. So there then becomes a need for us to have a new lottery in order for there to be some equity, because if not, then those folks who would have been displaced because of quarantine and isolation would then only get what was left, and that's not equitable either. And so there is a new lottery that's being run. Again, Angie is answering a lot of those questions in the background. I have seen that go. So I'm because there's a lot of detail in that, and some of those questions we could go on for a while. But there were a number of other questions that were asked as well, that as I was following through the chat, asking about leaving for the weekend, and can you leave for the weekend and come back? What we are asking everyone to do, again, I talked a little bit about, we're creating this bubble when we're testing folks coming in and the consistent testing that we're doing. So we're asking everyone to stay within the area. You don't have to stay on campus. You can enjoy the Carlisle area. However, Margie talked about the CAN initiative that was discussed earlier. And this is an initiative in which local businesses have taken a pledge that they will make sure that they adhere to a lot of the safety protocols that are in place. We will be asking our students to really try to limit their interactions to those businesses as best as possible. However, we do understand that there may be a reason for a student to leave the area to go home for whatever reason. And if that occurs, what we would say is, when you return, first of all, please let us know if you're leaving, because that would trigger for us, we would need to monitor you. And when you come back, you may need to go into quarantine again, depending on where you've gone and how you've traveled. We would ask everyone, if you are leaving the area, please do not travel via mass transit, i.e. a bus or anything in which there will be multiple people there. If you have your own private transportation, that would be best. That would be the safest. But I think we can all understand that planes, buses, trains, there are people that may be on those or in those vehicles that have not been tested and may have the virus, and then you returning to campus may impact us here. So there is a chance that you may have to go into quarantine. Dawn talked a little bit about a new measure that was put in place just recently with the governor's office here in the state of Pennsylvania, which says that anyone who's coming from out of state must quarantine before they return, and or have a negative COVID test before they're allowed here in the state. And that actually goes into effect, if I recall correctly, tomorrow, I believe, that begins. And so not sure what measures will be in place come January, but that is a measure that has just recently gone into effect. So whatever laws or measures are in place at that time, we will be asked to follow. There were questions about how many people can guests or whatever can be in an apartment or a room. What we are saying is we're looking at double the occupancy. So if you were in a room and there are 2 people in that room, then you can have 2 additional guests. So up to 4 people would be able to be in that room. If you're in an apartment and that apartment has 5 people in the apartment, then each apartment mate could have 1 person. So up to 10 would be allowed in that space. And that's how we're working the numbers there. So again, we want people to be able to have the freedom to have some guests, but again, there needs to be some limitations that are put on that. Athletes in pods. There was a question, would athletes be placed in pods? And we are looking into that. That is the goal. If athletes come as a team, and still not sure if that's going to occur, but if it were a team that were to come, it would work best for us if that team were placed in a pod. Why? Because you would be practicing together and doing other events together. And so therefore living together in a pod would probably serve you well and serve the community well also. So those are many of the questions. And again, I know Angie is in the background answering a lot of the questions regarding the lottery program. Margie, you're muted.
Sorry, I'm usually the one saying that. I don't think you covered disability accommodations. There were a number of related to that.
Well, if there are disability accommodations that are required, we will be going through the same process. They would go through Marnie Jones and work there, and we would look at that and we would make the appropriate accommodations. That has not changed.
Absolutely. All right. Thank you, George. We are just about out of time. So let me just say a few things. If you have additional questions, remember, ask@dickinson.edu and we'll get back to you. If we haven't been able to answer your question during this hour together, and we have a name, so many, the majority I think have come in anonymously, so we won't be able to get back to you directly. But as I said earlier, we're going to roll these questions into our FAQs. There are quite a few, about 120, so it'll take a little time to put that together, but they will be, the answers and the questions will be up on our website. So I thank you. And I just want to reiterate what I said at the beginning. This is an extraordinary challenging time for you, for your families, for your friends, and we certainly understand that. And stay strong, stay Dickinson strong, wear those masks, and there is light at the end of this. We all wish it would be tomorrow. I've had questions, can we get that vaccination in December? Well, it looks, very clearly that the healthcare workers, our frontline people, will get those vaccinations first. We don't know exactly what the rollout will look like. We're getting some information from the incoming administration about their priorities, but we really hope by the end of the spring, early summer, all of us will have access to those vaccinations. So I thank you for your patience. I thank you for being a Dickinsonian. Have a wonderful Thanksgiving. Stay safe, and thank you for being with us tonight. Good evening.